Hi there. I'm going to talk about the medical metaverse and using tech for good. So the medical metaverse blends mixed reality, AI, and other emerging technologies to reshape how we manage our health from diagnosis to rehabilitation. And it was recognized this year by the World Economic Forum as a top emerging technology. So I was very curious to explore how this might be making an impact in 2024 and what it actually meant. So I thought I'd just take a closer look at four trends to watch next year and take you through them. First one is digital twins. So digital twins are virtual replicas of a physical object, person, or process that can be used to stimulate its behavior to better understand how it works in real life. So imagine a digital replica of your brain. It's live data aiding doctors with real-time health analysis. So this matters because it can help with more personalized treatments and safer surgeries. And this industry is definitely one to watch out for next year because it's projected to reach 2.1 billion by 2024 and 5 billion by 2031. And I wanted to show you a few examples that I thought were cool. So Medical Holodeck is a VR suite of apps for surgical planning, training, and medical education. And it's got apps with cool names like Dissection Master XR. And it's where doctors can walk around a virtual human and a human body, sorry, and explore anatomy in detail. So it can inspect the organs up close and it can collaborate with colleagues while doing it. There's another one, Immersive Touch, that uses patient data to create a virtual twin so they can have realistic surgical planning using VR. The software lets surgeons see inside a patient, plan procedures in real time, and practice virtual models before surgery. And then there's Fundamental VR, which uses haptics technology along with VR and AI to create actual hands-on virtual experiences for doctors using haptics so they can feel everything. So by helping surgeons hone these skills and stay updated on these practices, it actually lowers risks for the doctors and also improves patient outcomes. And excitingly, we're going to be working on a digital twins project next year, so I can't wait. Trend two, patient and healthcare provider management. So it's estimated that the minute a patient walks out the door, they'll forget 40 to 80% of what their doctor has just told them, and I can relate to that. But thankfully, there are new health apps that are improving how patients can manage their health, utilizing subtle gamification techniques that can help provide better data for better healthcare providers. Improved patient-doctor communication not only empowers patients to take control of their health, but it also reduces administrative burdens, leading to substantial cost savings for practitioners. So here's two examples in this space. TheraTrack is an Australian startup. It's a communication scheduling platform that streamlines patient-therapist interactions for young patients. And it's got these wonderful gamification features that make therapy and medicine routines a bit more fun and therefore more motivating for children to keep up their routines. Crucially, this engagement helps therapists by increasing patient motivation and treatment plan adherence, and it provides therapists better data to understand how children are managing their health routines. Another one is one that we actually built the first iteration of very proudly, and it's called Smiley Scope VR, and it helps to reduce anxiety in children by synchronizing real-world needle procedures with a virtual experience. And it's actually proven so effective that International Vascular Access Guidelines actually recommend Smiley Scope for use, which is awesome. And it's actually extended into other areas. So a recent example is Monash Children's Hospital in Australia, and it's begun using Smiley Scope to familiarize children with MRI machine sounds. And this helps them practice staying still before their scans. Trend three. So this one is AI in mental health care. Globally, 2 in 3 people with mental health experiences actually lack access to healthcare. But there is a new wave of technology that's interesting and maybe something to look at, and it's emerging as something that could bridge the gap. And I'm calling it a very silly name, but it's AI integrations for mental health and therapy. But with the use of AI and even virtual avatars, this actually matters because we're seeing how this new tech can have greater reach for people who can't get the help that they need. It can create more personalized plans, can provide conversation 24 hours a day. It can detect early warning signs, and it can enable early mental health interventions. And while I think we're going to start seeing more of these offerings in 2024 and beyond, there's still lots of ethical and privacy concerns that need to be navigated. Another one is called Wobot, and it's a AI mental health companion that uses AI with natural language processing for conversation, and it provides advice on sleep, worry, and stress. And therapists have found it useful for providing round-the-clock support and improving patients' engagement with behavioral exercises. And then there's Thymia, which they saw a growing depression epidemic against a really short supply of doctor availability in the UK. So they created a gamified therapy interventions app, and it's based on neuropsychology with AI analysis of facial micro expressions and speech, which they claim can quickly and accurately assess and monitor mental health conditions. And then finally, Replica. It's not your typical therapy app. It's actually branding itself as an AI best friend for life. And this virtual AI companion, it learns your texting style and interests, and it's always ready to talk and talk to you when you need. And they call it an empathetic friend. So as more apps like these ones, Wobot, Replica, and Thymia start to emerge, I think their impacts in the health space will be something to watch, and also to look at from an ethical and, as I said, privacy perspective in the coming years. And lastly, the fourth trend is digital immortality. So this is also known as grief tech, and these services offer to preserve your life story online and allowing your digital self to live on after you're gone. So this matters because while these current offerings are still kind of in their infancy, they're actually showing a path to a potential future where grief, healing, and memory intertwine with new ways to connect with your loved ones beyond their lifetime. So here's some very interesting examples. Vivid is a German company that wants to disrupt the funeral industry with their virtual memory spaces, and they're accessible to mourners from anywhere in the world. And their goal is to give people a virtual opportunity to say goodbye in times of grief and farewell, regardless of time and location. Another one is Storyfile, which blends conversational video, AI, and natural language processing to stimulate real conversations with deceased loved ones, and it preserves their responses for future generations to access. And it captures the stories of both notable figures who are still alive, like William Shatner, and everyday users, and it ensures a legacy for their future. And then finally, I had to talk about Kiss. So as you may have read this week, they're the first American band to digitally recreate themselves for the afterlife. And their belief on this is, to quote, "The band deserves to live on because the band is bigger than we are." And this actually seriously underscores the significance of digital legacy preservation. And it's got a really creative and unique way that future generations might actually use these digital legacies. So on that note, thank you very much.